Hi, I'm Dr. Menardi, the Director of the Veterinary Technical Solutions Department, and here at VTS we really have our major function is to receive all the calls that come in, all the product-related calls, product inquiries, any questions about adverse events or lack of efficacy reports. That amounts to about 150,000 calls a year, or over 600 a day. And when we receive these calls, we really have two major functions and two major missions as a department. One is to gather data and format the information in a way that our pharmacovigilance and regulatory departments can work with. And number two, and I think the most important one, is a service function. We provide a critical service in support of our brands, our products, our customers, and certainly the Mariel business. When we receive these phone calls, we have a team of very capable people who are able to analyze the data and then to assess what type of support might be appropriate for the customer, whether it's a veterinarian or a user. That support might be in the form of education, it may be in the form of providing product, or it may be in the form of monetary compensation for diagnostics and treatment of a certain case. Bottom line is we have very capable people who are adept at assessing situations and providing solutions for our customers.
What would you say is the role of VTS?
Well, VTS, what we do on a daily basis is we actually operate in two forms. We protect and we support. We protect our products and our brand, but we also support our clients, and we support you, the Mariel employee, the inside sales reps, and also our field team. We support by actually on a daily basis, we field calls where veterinarians are using our products, and they may have questions about dosing and administration, or questions about what if I dose the wrong way, or questions about have you seen this odd effect with the product. That gives us an opportunity to talk about the proper dosing and correct administration of the products, but also it gives us an opportunity to talk about some of the things that we've seen before with the products, if they have questions about adverse events, things of that nature. Pretty much we're making them feel more comfortable with the use of our products, but we're also educating them on how to use the product correctly so that we can get the desired effect. So that's how we support them from a technical standpoint. Sometimes we're actually asked to support them monetarily to help diagnose or treat a case where there was an unfavorable event after the product was used. This also gives us an opportunity to protect our brand, because let's say if one of our products were used and allegedly an adverse event happened, let's say seizure, if something like that happened, a vet thinks, oh, I use your product, now the dog's having seizures, but then we provide support to diagnose what's really going on. We find out, hey, this pet actually has some type of cancerous growth in the CNS or central nervous system. Then that protects our brand and makes them feel more comfortable with using the product, knowing that, hey, it wasn't your product, there was just something else going on that was underlying. So although that's just an example, we do have some similar things happen from time to time. And then as far as protecting our brand, we're obligated to report any reports that come into us that are unfavorable events to regulatory agencies like the Food and Drug Administration or United States Department of Agriculture. That gives us an opportunity to provide the correct information to those agencies so that they can see the bigger picture and not just a one-liner, hey, we use your vaccine, now the cat's doing this or the dog's doing that. You get a full picture of what the pet's environment was like and if there was anything going on that could have influenced those responses. We do have a team of veterinarians that work with us, a team of 7 currently, and then a director, making it 8, director of the department, Dr. Menardi. And then we have 2 branches in our department, or 2 teams of technicians. One would be frontline technicians, who they field calls most of the day from consumers, sometimes from clinics. And then we have a team called senior veterinary technicians, and they field calls from veterinarians and office managers with similar questions and concerns. And I'll be glad to show you around if you like.
Absolutely.
All right, well, let's do it. We're set up for our floor for how we field the calls that come in. If you look to my left, we have rows here of cubicles with people working there, frontline technicians, and they're currently on the phone now. And again, they receive most of their calls. A great percentage of their calls are from consumers. These would be pet owners, not the clients that are the veterinarians. So with pet owners, of course, there's varying degrees of knowledge as to how veterinary medicine works and how the product should work. So some of those calls can be some of the most challenging calls. Also, too, with pet owners, sometimes in some events, the filters that should be used aren't always used. So it can be challenging as well for these guys, but they do an excellent job. And when I say they do an excellent job, I learn from them daily. So they're going to get people that have varying knowledges or more knowledge, I guess, of veterinary medicine. They deal with office managers a lot, technicians a lot, and veterinarians a lot. And they will field calls that are coming into the veterinarians with questions or concerns about the use of the product. But their job is to get the data into the computer and to make sure that the veterinarian that's going to take that call is well versed on what the call is about. And again, we have a row of cubicles with our senior veterinary technicians. This is Rebecca. This is Margaret, one of our new techs. She's still in training. But what these guys are well versed at doing is all day they're going to take calls from clinics. They're calling in about questions, concerns, things that they need to know about the product or concerns they have about using the product. And these guys are very, very good at actually getting information that's going to be needed for regulatory agencies. Anytime there's a concern about the use of our product, we want to make sure we have the lot number for the product to make sure that there's not a problem with a certain or particular lot. But also regulatory agencies are going to ask us for the lot number. We want to make sure that the correct product was given. A lot of times a vet may call in and say, hey, we use your product and this happened. And then when they search for the lot number, we find out it wasn't our product. So we want to make sure we're dealing with our product. And then also we want to make sure that it was administered the right way. And these guys are excellent at making sure those things happen. And then if you follow me this way, we'll meet a few more vets, or at least one more vet. Maybe two more.
Because they're familiar with your pet and any pre-existing or anything.
Dr. Harrington here.
Hey, Doc.
Hi. Ask her some questions.
So, Doc, what kind of advice would you give for a new hire? Anything that you would say it's important for a new hire to know on how to utilize the VTS department?
I think that please utilize us, for one, because we're always happy to answer any of your questions, which I'm sure that you guys will have a lot of questions. Always when your veterinarian tells you something that was told to them by VTS, sometimes take that with a grain of salt and call us and just try to get what may have been said, because there's always those shades of gray, and they may have interpreted something that may not have been necessarily what we said. So definitely give us a call and we'll fill you in on what was said during our conversations. So, but we're always willing to talk to you guys.
Knowledge about the products and general information to try to help a veterinarian figure out how to use a product or if a product has caused an adverse event. And so we can be a good liaison to or a good person to go to for questions about products in general.
Right.
And also just to work with sales reps and field vets as an overall team to really provide good customer service for our customers, the veterinarians.
Wonderful, Doc. Well, thanks for your time.
You're very welcome.
So, in conclusion for my part of this presentation, one thing I would add is that if you have a client that has issues or concerns or something going on with a pet or a patient or our product, and they want to see if Muriel can provide some monetary support or some type of support, always have them call us at VTS. Don't offer any particular dollar amount, or don't give the impression that we're open to anything. Call us, give us a call, and we'll go over our guidelines of support, and we'll do the best to make sure that the customer's happy so that you're happy. So that's the way we're going to support you, by making sure your client that you've sold the products to are happy campers so that they're willing to purchase again from us. Okay?